And thank you for joining us. This is the Dr. Tommy Show Live. Joining you live, special presentation of the Dr. Tommy Show. Usually we run on 11:30 on Wednesdays, or thereabouts, if our patients allow. But patients come first. But today, we have a very special guest, and his name is Dr. Michael Hoffmann. He's a neurologist and is a specialist in the cognitive and psychological aspects of neurology as well as stroke neurology. It's my pleasure to have you, Dr. Hoffmann.
Good afternoon, Tommy. Thanks for having me on the show.
You're welcome, sir. Dr. Hoffmann is a neurologist, like I said. And when we were talking before the show, when I was first at University of South Florida, Dr. Hoffmann was attending on the stroke neurological stroke ICU, I think it was called. And I had such a great experience then that I considered doing stroke, actually just specifically stroke neurology. So I credit you and Dr. Malik for that, piquing my interest, and it was a wonderful rotation. Actually, as much as medical school is, a lot of the stuff you learn and whatever, but I actually took some really good nuggets from that. So I really appreciate that. How is your brain is a complex organ, and we have a lot of questions that people ask, but I want to try to keep it as focused as possible. Your brain, people talk about the brain as we only understand, what do they say, like 10% or 15% of the brain. What about the brain makes it such that, is there any way we'll ever be able to understand it to the level that we understand the heart or the lungs or an organ like that? What do you think?
We don't know, Tommy. We're making a lot of progress, especially in the last 10 years with supercomputers and new ways of imaging that we never conceived of before.
Mm-hmm.
50 years ago, nobody conceived of the internet.
Mm-hmm.
And so we have increasingly powerful tools that help us delve into the brain's workings. It doesn't only limit itself to imaging, but also to molecular aspects and chemical aspects and genetic aspects. And what we're also realizing is that there's a lot more we can do to protect our brains. For example, lifestyle rules, brain fitness rules, in other words, it's suddenly been realized they're far more powerful than we ever thought. A simple thing like engaging in regular exercise can decrease your risk of developing dementia, stroke, heart attack by up to 50%, 50.
Yeah, I was reading in your book, or reading an excerpt of your book, or maybe it was online, and you talk about AD, Alzheimer's disease, being diabetes type 3.
Yes.
So it's metabolic and a vascular disease.
Yes. In fact, the latest theories about how one gets dementias, such as Alzheimer's, is that your small brain blood vessels start to clog up.
Mm-hmm.
And what clogs them up? Probably a too high sugar diet. Not a too high fat diet, but too high sugar diet.
Mm-hmm.
And that's one of my favorite topics, is this cholesterol myth, and that fats are bad for you. The reverse is true. Our brains are about 3/4 fats.
Sure.
Special kinds of fats. And if we mess with that metabolism or intake or drugs that decrease fat absorption, I think we're causing a lot of trouble. And there is evidence that the rise of neuropsychiatric disease in this world, of which you see examples every single day, may be attributable to our poor diet and or medication that decrease cholesterol, for example.
So that flies in the face, obviously, of the, I guess you call it mainstream, what we've been taught for, I don't know, the past 30 years or 20 years at least, about lowering aggressively cholesterol. And then, they talk about omega acids are good for you, but omegas are good fats, but then the other fats are not. But you're saying in general that it's the sugar that's the problem, not the fat.
Sugar is the problem, yes.
And that's something that is something for, when I was a resident or student, I remember you talking about, it was either you or Dr. Malik were saying that, if someone has vascular disease in their heart, it would stand to reason that they have vascular disease in their brain as well.
Correct.
And so a lot of the things that we're talking about for heart health, brain health follows that exactly.
That's quite correct. Although the different vascular beds react differently, the heart and brain are very closely linked. So if the heart gives up, the brain will give up too.
Right. What about the fats that they are talking about now is saturated fats and trans fats? They say are very bad, but they say that unsaturated fat is okay, but saturated fats are not good. But I saw a gentleman I think he's with the Cleveland Clinic or Mayo Clinic. He's a cardiologist. He's in charge of some division, but he's saying that saturated fats are not bad for you.
No, that's right. We're learning more and more about it. Fats have just in general been delegated as bad foods.
Mm-hmm.
Meanwhile, they're critical to our brain health. And for example, LDL is something that worldwide, cardiologists, especially internists, have said the lower the better. Well, that's not true. There's good LDL and there's bad LDL. The small LDLs are bad for you. The large LDLs are good for you. When you get the blood test, it
Mm-hmm.
measures all of them together.
Right.
And a lot of people think that a total cholesterol over 275 is abnormal, but anything up to 275 is still fine and it does not need to be treated.
So you're in an academic arena. I mean, you're
Right.
a professor. How does this jive with the other members of the different departments? For instance, are they coming on board with this, or do they think this is still experimental, or is this becoming back to be? Or soon there could be a Time magazine where they're going to say LDL is the molecule of the year, like they did with nitrous oxide, and then how quickly do you think that will swing around to where LDL is no longer the boogeyman it was?
It's swinging around all the time. There's more and more reports. There's more ads. There's radio shows. There's TV shows coming from everyone, largely cardiologists actually, who tell us that the cholesterol. Tell us about the cholesterol myth,
Mm-hmm.
and that statins are not really effective in controlling heart disease at all.
What about for inflammation? So when I was a
Yes.
student, I hate to keep going back to it, but that's, like I said, that's where I got a lot of my knowledge of what I still know about
Right.
stroke. I remember we would have a patient come in, have a stroke, okay, a hemorrhagic stroke, for instance. And then we get the hemorrhage under control. The hemorrhage starts to shrink, and then you test their cholesterol, and their cholesterol is normal. Okay.
Right.
But then we start putting them on a statin for anti-inflammatory effect.
Yes.
What is that?
That is true.
Okay.
The one thing that statins do is they have an anti-inflammatory effect, which is beneficial.
Mm-hmm.
However, it's because you've allowed your arteries to become inflamed by being blocked up with too much sugar, actually, and triglyceride buildup. Triglycerides is actually the end result of having too much sugar.
Right.
And that leads to an artery that becomes blocked and inflamed. So
Mhm.
in that way, statins are of assistance, but not by lowering cholesterol. There's never been any study that shows that lowering the cholesterol has helped. It's been the anti-inflammatory effect that's helped. Now, the saturated fats, most of them are actually good for you. In
Mhm.
fact, the ones in dairy, I think the name is palmitoleic acid.
Yes.
That is a saturated fat that lowers your cholesterol, interestingly.
Mm-hmm.
And dairy products are healthy for you, provided you have the full fat dairy products. Unfortunately, there's been a huge trend in industry to consume low fat dairy products, or even worse, 0% fat.
Mm-hmm.
And all that's happened is if you remove the fats, these foods are so unpalatable
Mm-hmm.
that they have to add a huge amount of sugars back.
Right.
And so you start with a product that's many times worse.
Yeah. So because you're getting the low fat label,
Yes.
in order to make anybody want to eat it, you have to load it down with sugar.
Exactly.
And it's the same thing for any type of processed meal. I always tell
Yeah.
patients, if it comes in a box, it's going to be by definition, and it's prepared already. It's going to be a definition have more salt and more sugar in it just to make it palatable.
Yes.
And so that's one of the things that, again, a lot of this I've seen, and I don't know how much of it's conspiracy theory or not, but a lot of the anti-fat movement, they say, is funded by the sugar lobby as a way to, like you just said, because if you got to reduce fat, then you got to increase sugar. So I don't know if that's true or not, but it does correlate, like you said, that a low-fat product is going to be higher in sugar. As far as sugar from an anti-inflammatory, we talked about sugar is bad. How does sugar, for just the layman out there, how is that inflammatory or cause an inflammatory process?
By sugar was was part of our diet for many millions of years. Back in the Miocene, you're talking about 30, 40, 50 million years ago, when our diet was largely fruit. And of course, that's what we survived on, and we did that in a very healthy way. And sugar is something that our bodies are very much used to in the form of fruit, but not refined sugar. Now, when environmental conditions changed in the last 10, 20 million years, our bodies were forced to store more fructose, which is the sugar in fruit, as fat, so we could survive the lean times. So we have a special biochemical mechanism that immediately stores any sugar as fat,
Right.
which works very well for us, provided we don't have too much sugar. Of course, today we have about 300 times more sugar than we normally are allowed.
And provided, too, that when that did happen evolutionarily, that you had an active lifestyle, which is the opposite of what most Americans, at least, or I guess people in the industrialized world in general, have, is a inactive lifestyle. So it's compounding. You increase the sugars.
Doesn't help.
And then you decrease activity, then you have a double whammy.
Correct.
We had a couple questions, and I don't want to let them be disappointed. One of the questions we had about is short-term memory.
Yes.
I remember in medical school, I think it was, that I learned that that short-term memory is kind of more akin to attention rather than actual memory. Is that true?
It's absolutely correct, yes.
Okay.
You know, by short-term memory, in neuropsychological terms, you're really referring to what's called working memory. And working memory is another term for the operating system of our brain.
Okay.
It's also a form of attention.
Right.
So if I gave you a 7-digit telephone number, you'd have to keep it in your mind long enough to be able to dial it. And that is probably one of the best example of how short-term memory, or working memory, as it should be called, works. Also, when you speak, before you open your mouth, you would have already formulated what sentences you want to say, but you have to keep them in mind long enough to be able to speak them out. That is all working memory in action, if you like.
So I remember there was a time we had a patient had a stroke, and we said, tell me what your name is. And the patient was, my name is, and they were very non-fluent. Right. And then you said, all right, now sing Happy Birthday for me. Happy birthday to you. And they were able to sing that. Is that from a different part of the brain that they were able, is that like you're saying?
Yes, that's something slightly different. So that's a very good example of how powerful the music circuitry in our brain is. There's a lot of evidence that music was within our brains at least 1 million years before language. So we sang a long time before we ever spoke. So
like birds sing and things like that.
Yeah. And so the music circuitry is very, very expansive in the brain. And if you have a language impairment, the music circuitry can come to the rescue.
Okay.
And enable you to formulate the words better. But you're going to sing them. And this is the basis of why melodic intonation therapy is good. So we get people to sing rather than to speak, and they do much better.
What can people do? There's a lot of people, like you were talking beforehand, I do concierge medicine. And
right.
you brought up that, that's kind of what you wrote about in the back of your book is the brain box and all right. the optimizing things. People want to optimize their memory. One of the things that one of our people asked, I think it was actually our clinic coordinator, Tracy, is is there exercises to do to improve your memory, your short-term memory, for instance? Because some people have problems with it.
The first thing you have to make sure is that the basic organ, the brain, your computer in other words, is in optimum functioning capacity. And, adhering to the 5 brain fitness rules takes care of that, which is physical exercise, cognitive exercise, eating brain foods, socialization, and sleep hygiene.
Can you show us your book?
Yes, sure. So this is Brain Beat. It's basically a scientific foundation and evolutionary approach to brain health. And the reason why I wrote it is because I want people to understand not only how to do things. I don't want to just give them a list of to-dos, but I want them to understand why it happened like that. For example, why is it that when you do physical exercise, you actually grow new brain cells?
So talk about that then. So every time you exercise, you're growing new brain cells?
Yes, and if you do several hours of exercise over a number of days, you may grow to between 3 and 4 million new neurons. And that's been shown in mice on a treadmill, for example.
So the neurons you're born with aren't the neurons you
No.
get. So you can actually, hyperplasia, I guess it would be.
Yes, you're growing new brain cells every single day. You're also making new connections.
Mm-hmm.
And that leads me to the second, one of the other brain fitness rules, sleep hygiene. And one of the functions of sleep is to prune your brain.
Yes, I've heard that.
Yeah, so topiary, if you like,
Mhm.
which is pruning. So you're making way too many connections and synapses every day, most of which you don't need, and that has to be pruned away.
Mm-hmm.
So it's like building up too much garbage. If
Mhm.
you don't get rid of your garbage, you're going to slow down the functioning.
Okay.
So sleep, of course, has very important memory functions. It has dreaming functions, which allows you to be creative, but it also clears out waste in the brain.
Is it kind of like, when you reset or clean the cache out of your internet browser, if your browser's
Yes.
running, just delete it?
That's a good analogy.
Yeah.
Absolutely, yeah.
So what's step 3?
Step 3, brain foods.
Okay.
The principal brain foods are things like fruit diet, vegetable diet, seafood diet is critical, is the most important. And then
Is that because of the fats?
mostly DHA,
Uh-huh.
omega-3, omega-6.
Would you recommend someone just take a supplement daily for like DHA or for?
No, that's only if you cannot, for whatever reason, eat proper seafood. But whole
Okay.
foods are always the best
Mhm.
packages, because it's not only those critical fats, but there's also selenium, zinc,
Mhm.
copper, iron, and iodine. Those 5 minerals are absolutely key for optimum brain function. You only get those through seafood.
Mhm. Do you recommend people who do not have a good optimal diet? Do you recommend them take any multivitamins?
No, just in general, medical practice today is against taking
Mm-hmm.
vitamins unless there's a established laboratory deficiency.
Mm-hmm.
Otherwise, you can actually make people worse.
How's that?
Well, it's been linked to an increased cancer rate, for example.
Because of just too much activity?
Well, you're interfering with the microbiome.
Uh-huh.
In any of the food diet-related studies, if they've just changed one component, they've generally been either negative or have shown a worse outcome.
Mm-hmm.
You have to change whole diets, and that's why all the studies with the Mediterranean type of diet have actually been successful.
Yeah, that's a diet that we advocate for, because
Yes.
it's not only is it a good diet from a medical standpoint, but it's actually tasty.
Correct.
Whereas a lot of diets aren't.
Yes.
So what's step 4? We're at step 4 now, I think.
So cognitive fitness, cognitive brain exercise, that can take a number of forms. You could play computer games, but
Mhm.
as long as it's not overdone. But it includes things like playing chess, playing card games, board games,
Mhm.
doing writing courses, doing an extra degree, learning a new language,
Crossword puzzles.
crossword puzzle, excellent, Sudoku, knitting. All of these are what we call cognitive exercise, and they increase your cognitive reserve so that you have extra brain padding. So if something does affect your brain one day,
Mm-hmm.
you may not even notice it.
I have a patient that has an MRI that shows, if you were to look at the MRI, a lot
Mhm.
of atrophy, but cognitively, there's, as far as I can tell, very normal, so to
Right.
speak. Does that mean that they had some reserve and now maybe they've bought into that reserve and they're going to have some type of decline later, or is it just an anatomic thing
It
that's
can
a variant?
be. It can be. We see brain scans that look shrunken, for example. We call
Mhm.
it atrophy. But even more so, we see brain scans with a lot of white matter lesions on them.
Yes.
And these are actually, I call them cortical scars.
Okay.
It means that there's been some damage to the brain.
Okay.
And you wouldn't want that to continue for too long, because it could suddenly worsen and become a clinical syndrome.
Okay, if they take that patient, then they're normal, quote unquote, and they have the cortical scarring, atrophy. You repeat the MRI in 6 months from an imaging standpoint, as well as following them. Would you, or a year or sooner?
Probably not 6 months, but 1 or 2 years.
Okay.
And what I ask people to do is to follow the brain fitness rules, and I've seen reversals in the number of white matter lesions, for example.
Reversals.
Yes, and also an improvement in their cognitive functioning. And of course, at the same time, you'll see that they've lost weight, their blood pressure's come down, their diabetes has improved. So there's a very tight link between your body metabolism and your brain function.
Well, the patient that I'm speaking of is a patient who, when we were talking about it, we were looking up different reasons, and I was going through all the different possibilities. Lyme disease is another one someone had a question about. But I talked to the radiologist, and he says, look, it's small vessel disease. And I said, well, she don't have this, she don't have this, she don't. But she admitted to being a sugar addict previously. And so that may tie in directly.
Oh, absolutely. When you say small vessel disease, that is a big red flag for me, because it's the small vessels that supply the brain cells. And if your fuel supply is starting to diminish, your brain function will follow suit and also decrease. So that's the time to intervene. If you don't intervene, then it may be too late.
So if you intervene, meaning start doing some of the things that are in the book. Okay. What's step 5 before I want to ask one more question after that?
We've covered physical exercise, cognitive exercise, brain foods, sleep hygiene. 5 is socialization.
Okay.
So we as primates in origin signed a social contract for protection against predators. So we go around as a group for protection. I mean, that's it in a nutcase. And that works very well. But the problem is we have to get along well with each other. And that is in our best interests. However, it takes a lot of brain power to do that. And one of the theories is called Dunbar's number, is that our brains increased in size primarily because we had to socialize more and more and more.
Okay.
And he came up with the magic number of 150. That's kind of the most we can socialize with. And there are lots of studies to support that now, to show that people that are, for example, recluses, they have a much higher incidence of cancer, stroke, heart attack, even infections.
Interesting.
And socialization decreases inflammation, increases oxytocin, for example, which is beneficial, and is protective from a cardiovascular point of view.
So the number 150 is the number of what?
Is the maximum number of people that you can really know.
So all these people that I see on Facebook and LinkedIn that have 10,000 contacts, not necessarily their brain is much better than mine.
In fact, the people that we deal with mostly are just 5.
Yes, that's true.
The family unit.
Well, that's absolutely true.
And 15 is the next step.
Okay.
Which is a sort of close circle of friends. And then above that is about 50. So they go up in multiples of 3. And 150 is kind of the most people that you would have as possible friends, even remote acquaintances.
Right.
Some people call it a Christmas card list and so forth.
Very good. One question we had from a patient was Lyme disease.
Yes.
What is the effect of, I mean, this is a very broad question, but tell me from your experience, what is Lyme disease? What can it do, or what does it do to the brain?
Well, Lyme disease is a strange infection, much like syphilis, for example. It can cause almost any kind of neurological syndrome. So it could be mild cognitive impairment, it could be paralysis, it could be blindness, double vision, just fatigue. And we have to be very careful we don't miss it, because these are eminently treatable disorders.
And chronically, though, once there's acute, a lot of the controversy now is there's no good way to treat chronic Lyme disease, or some people believe that doesn't exist because the standard laboratory measures we have to capture that don't. So it's almost become like a fibromyalgia of the brain, where it's just like, is it real? Is it not real? But for those people who have chronic Lyme disease, what's the prognosis for them? They've not been treated acutely, and now they have these tertiary symptoms.
Well, it may be something similar to what we're seeing in a condition called Gulf War illness, where it took about 25 years to work out what was going on, but there was a synaptic poison, if you like, and that's interfered with the normal brain functioning. And not only does it interfere with the brain, but with the joints, with the muscles, with the nerves. And so these are people who were given a diagnosis of fibromyalgia, but there was a lot more going on than that. And with the troops, for example, it was actually the antidote against nerve poison that was causing a synaptic problem.
And that's Gulf War syndrome.
Gulf War syndrome.
before we go, and I don't want to keep you too long, and I do appreciate you coming in all the way from Orlando, where you were at an international conference. What was the conference?
It was an international neuroscience conference. Quite a big group, and I spoke about the neuroarchaeology and the assembly of the executive mind.
That's something that I think all of our patients in the concierge medicine world, but in general, just people looking to optimize their health should check into, because your brain is your brain. You know, it's one thing to have a bad back, but you have a bad brain, you're kind of up the creek without the proverbial paddle. One thing I just want to ask you is, from your standpoint of a brain specialist, is there any benefit to doing these things that are called detoxes, where they supposedly take out the toxins out of your body? Is that something that they say it accumulates in fat, in the liver, for instance? Is that something that is anything that you're familiar with, or that you have an opinion on even?
No, I'm not familiar with those things. I hear about them, but I don't know that there's any good basis for that. Mm-hmm. But I'm not an expert on it.
Great. Well, thank you, Dr. Hoffmann. How can we get in touch with you if we want to learn more about what you're doing?
Well, I have the website up, and
I'll show that to them.
I can give people an email contact if they want to ask questions.
Go ahead. You want to give them the email?
Yes, mhoffman4@me.com. 2 F's, 2 N's.
2 F's, 2 N's. And Dr. Hoffmann, I really appreciate you coming on. It's been a pleasure, and I'm glad we were going to have to do this remote, but I'm so glad that you were able to come all the way over here and find our little office in Wesley Chapel and share with us. And thank you again for the excellent teaching that I received on behalf of all of our classmates, too, when I was at USF.
My pleasure.
Thank you, sir. And for all of you out there listening, to get more of the Dr. Tommy Show, subscribe on YouTube. And then Dr. Hoffmann's book, I'm going to put a link to it, but I'll put a link to his website. And this is Dr. Hoffmann's book. And he's got several books.
2 at the moment.
He's got something coming up in 2017, looks like.
Yes.
Too.
Right.
All right. Thank you all for joining us. And until next time, bye-bye.